Can you sleep with a tampon in? Yes, you can sleep with a tampon in. Some people find it more comfortable to do so, especially if they are heavy sleepers. However, it is important to change your tampon every 8 hours or so to avoid infection. You should also be sure to wash your hands thoroughly before inserting or removing a tampon. Many women choose to wear tampons overnight for peace of mind, while others find them uncomfortable and prefer to use pads instead. So, what's the verdict? Is it safe to sleep with a tampon in? Let's take a look at the pros and cons. On the plus side, wearing a tampon overnight means that you won't have to worry about leakage or stains on your sheets. Tampons can also give you a feeling of freshness and dryness that pads may not be able to provide. However, there are also some potential downsides to wearing a tampon overnight. One is that it can increase your risk of toxic shock syndrome, TSS, although this is rare. Wearing a tampon overnight also means that you'll have to get up in the middle of the night to change it, which some women find disruptive. If you do choose to wear a tampon overnight, be sure to use the lowest absorbency level possible and change it as soon as you wake up in the morning. How long can you sleep with a tampon in? How long can you sleep with a tampon in is a question that often comes up, since it is important to know how often to change your tampon. The answer largely depends on how much menstrual flow you have. If you have a heavy flow, you will need to change your tampon more frequently than if you have a light flow. It is also important to pay attention to how often you need to urinate, as this can also affect how often you need to change your tampon. Generally speaking, it is safe to sleep with a tampon in for up to 8 hours. However, it is always best to err on the side of caution and change your tampon more frequently if you are unsure. Can you sleep with a tampon in for 10 hours? The answer to the question, can you sleep with a tampon in for 10 hours, is yes, but there are a few things you should keep in mind. First, it's important to choose the right absorbency for your needs. If you're going to be asleep for 10 hours, you'll need a tampon with higher absorbency so that you don't have to worry about leakage. Second, make sure the tampon is inserted correctly. The best way to do this is by using a mirror so that you can see what you're doing. Once the tampon is inserted, relax your muscles and let the tampon do its job. Finally, make sure to change your tampon first thing in the morning so that you don't get trapped in air pockets which can lead to discomfort. Can you sleep with a pad on? For anyone who has ever had their period, the question of whether or not you can sleep with a pad on is a valid one. After all, no one wants to wake up in the middle of the night to a leaked pad. So, can you sleep with a pad on? The answer is yes, but there are some things you should keep in mind first. Sleeping with a pad on is totally up to you. Some women find that it helps them feel more relaxed and comfortable, while others prefer not to wear one at night. There are benefits and drawbacks to both approaches. On the plus side, pads can absorb any blood or discharge that leaks out during the night, which means you don't have to worry about ruining your sheets. They can also help you feel cleaner and fresher when you wake up in the morning. However, pads can also be bulky and uncomfortable, which can make it difficult to get a good night's sleep. Ultimately, it's important to do what feels right for you. If you're someone who feels more comfortable sleeping with a pad on, then go ahead and give it a try. But if you'd prefer not to wear one, that's totally fine too. Experiment until you find what works best for you. What is toxic shock syndrome, TSS? Toxic shock syndrome, TSS, is a rare but serious condition caused by bacteria. TSS can occur in anyone, but it's most common in women of childbearing age. TSS is typically associated with tampon use in young women. However, it can also occur in men, children, and postmenopausal women. TSS can be life-threatening if not treated promptly. Early diagnosis and treatment are critical. What are the symptoms of toxic shock syndrome? Symptoms of TSS occur suddenly and may include fever, vomiting, diarrhea, dizziness or fainting, muscle aches, confusion, redness of your eyes, mouth, throat, or skin, seizures, headaches, Rash that looks like a sunburn, often on your palms and soles. If you experience these symptoms, it's important to seek medical attention immediately as TSS can rapidly progress and become life-threatening. Risk factors for toxic shock syndrome. There are several things that can increase your risk for developing toxic shock syndrome, including use of tampons. TSS is most commonly associated with tampon use in women of childbearing age. Recent childbirth or abortion. Childbirth or an abortion increases your risk for developing TSS because it creates an opening in the lining of the uterus. Use of vaginal contraceptive devices. These include diaphragms and cervical caps. Skin wounds or surgery. Having surgery, including cosmetic surgery, or having skin wounds, including burns, increases your risk for developing TSS. Infections. Strep throat or impetigo, a bacterial infection that usually affects children, can lead to TSS.